Good morning, all of you. Welcome back, my dear friends. Welcome to my channel, and please subscribe to my channel. Let us go forwards and try to see the third lesson of this spotters. Okay, what are the structures we can identify in this head and neck? Now, the first and foremost thing which we are going to see is ophthalmic artery. So, examiners they doesn't ask this tricky question, but sometimes if the examiner want to give a bouncer question to you, he may ask this question. Okay, so how to identify this ophthalmic artery? This ophthalmic artery finding is very easy because the main artery, one and only artery which is present in this orbital cavity, that is nothing but the ophthalmic artery. So if they tie any structure artery in the orbital cavity, that is nothing but the ophthalmic artery. Okay, so let us see that. So here you can see this is the bigger one. Thick structure is nothing but the optic nerve, and then this ophthalmic artery actually it is passing through the intermediate compartment of superior orbital fissure and enters into the orbital cavity. So you try to remember that. So just lateral to this of the optic nerve, that is nothing but the ophthalmic artery. Okay, that is to identify the ophthalmic artery. Let us see that. Next, we are going to see the facial vein. How to identify the facial vein? So facial vein identification is also very easy. So already have seen the facial artery over here. Then the thin wall lumen structure. Thin wall lumen structure is nothing but the facial vein. Here you can see that it's a thin wall and it is slightly appearing like a dark structure. It is actually the course of this facial vein is straight. Okay, so straight. So this is nothing but the facial vein. Facial vein. Then external jugular vein. How to identify the external jugular vein? External jugular vein identification is, so this vein is present in the neck. This vein is present in the neck. So, and also it is running superficial to the sternocleidomastoid muscle. Superficial to the sternocleidomastoid muscle. So that is to identify the external jugular vein. Yes, here it is. Right. So it is also thin wall structure. You can see some slightly it is appearing like a dark structure. That is nothing but the external jugular vein. And internal jugular vein. How to identify the internal jugular vein? So internal jugular vein which is present along with the common carotid artery. Along with the common carotid artery. In our previous class we have seen the common carotid artery, external and internal carotid arteries. So the common carotid artery which is present in the carotid triangle of the neck. Okay, so in the carotid triangle of the neck, which we can identify the common carotid artery. Along with that, we can identify this dark color thin wall structure. A bigger one is nothing but the internal jugular vein. Here you can see that. So that is to identify the internal jugular vein. Next, facial nerve. How to identify the facial nerve? So if you just look at the facial nerve, emerging of the facial nerve into the face. So actually it is a seventh cranial nerve. It is coming outside through the stylomastoid foramen. Then after that it is piercing the parotid gland. And then it runs forwards and gives the 5 branches. Okay, so that's all about the course. You can study the course, but to identify the facial nerve, so the facial nerve which we can identify by the side of the face, means at the lateral aspect of the face, which we can identify here. Let me show you that. Yeah, here you can see that. So this is nothing but the facial nerve. Okay, so the facial nerve, the branches they may tie, any of the branches they may tie and ask you to identify the tied structure. So we have to find out that it's a facial nerve. They are small thread-like structures and they are tough. Okay, so the one branch of the facial nerve which is running over the parotid duct, another branch running below the parotid duct. So try to see the parotid duct, the bigger one, duct-like structure. Any thread-like structures which are present above or below, if they tie any of that, you can easily identify it as facial nerve. This is nothing but the facial nerve identification. Now moving to the parotid duct. So parotid duct actually it is emerging anterior or extending anteriorly from the anterior border of the parotid gland. So here, this is the parotid duct, and it is running over the masseter muscle, So the masseter muscle, which is present or attached to the lateral surface or external surface of the ramus of mandible. On that surface, we can identify this parotid duct. Yeah, here it is. And then abruptly, it disappears here. It does not extend. Okay, so it is taking a 90 degrees direction deviation and pierces the buccopharyngeal membrane. Then it enters into the oral cavity. Okay, so the next question they usually ask is, where does it opens? Okay, parotid duct, and where does it opens? Next artery is middle meningeal artery. How to identify the middle meningeal artery? It is very easy. So to identify this is, they have to point out in the cranial cavity. So that does not show you in the infratemporal fossa, because it is a small part of it we can identify in the infratemporal fossa. So they most probably they put this structure in the cranial cavity. So in the cranial cavity, you can identify the vessel, which is nothing but the middle meningeal artery. This is the big artery, and it is having two branches. So they may ask anything, what are the branches, and name the importance of the anterior branch of middle meningeal artery, and they related to the pterion, they may ask about it. Next one is superior sagittal sinus. To show the superior sagittal sinus, this superior sagittal sinus, it is present in the falx cerebri. Okay, so I think already you might have studied about the dural folds, the falx cerebri, falx cerebelli, tentorium cerebelli, the falx cerebelli. So in the falx cerebri and the superior margin of the falx cerebri, you can identify this superior sagittal sinus. Okay, this is superior sagittal sinus. Okay, so that is to identify the superior sagittal sinus. And last one is, which we are going to see, is basilar artery. If you want to ask the another artery from the neuroanatomy, probably they ask this basilar artery. So you no need to worry, worry to find out how the basilar artery is present and where the basilar artery is present. So definitely they have to keep the base of the brain, and they have to expose the basilar artery clearly. So try to see the basilar artery. Yeah, here you can see that. So at the base of the brain, this basilar artery is formed by the joining of right and left vertebral arteries, and this basilar artery is present at the anterior surface of the pons on the basilar groove. Okay, so that is to identify the basilar artery. Okay, so that is easy to identify the structures. If you are feeling any difficulty, please write in the comment box. Thank you, dear students. See you soon with the new class.